the 5 rights of medication administration: right patient, right medication, right dose, right time, and right route. These are so fundamental that the NCLEX loves to revisit them in various different ways. Number 1, right patient. Always verify the patient's identity using 2 identifiers, like their full name and date of birth. Never rely solely on them saying, "Yes, that's me." Double check wristbands and medical records. The test might also present a scenario where 2 patients in adjacent beds have similar names. Ensuring the correct patient is key to avoiding a catastrophic error. Number 2, right medication. Compare the medication label to the order at least 3 times. When you first pick it up, before preparing it, and before administering it. The NCLEX might show you a scenario where the medication name is similar to another drug. The question could be, what's the best action? The answer is often to verify the order or contact the pharmacist if you're not sure. Number 3 is right dose. Double check calculations, especially for high-risk medications like insulin, anticoagulants, or opioids. The exam might ask you what you do if a dose seems unusually high. Typically, verifying with another nurse or calling the prescriber for clarification is the safest step. The NCLEX wants to see if you'll pause before giving a suspicious dose. Number 4, some medications need precise timing for maximum effect. Antibiotics often need consistent intervals to maintain therapeutic levels. Pain medications should align with the patient's needs and pain cycles. If the test shows a scenario where a med is due now, but the patient is off the unit for a test, it might ask you how to handle timing. Often, the correct approach is to safely administer the med as soon as possible when the patient returns, or clarify with the provider if timing is critical. Number 5 is right route or route. Make sure you're using the correct route: oral, IV, subcutaneous, intramuscular. Misadministering a drug via the wrong route can be deadly. The NCLEX may describe a situation where a patient cannot swallow pills and you must identify whether a medication can be crushed or given in an alternative way. Understanding the correct route is key. Beyond these 5, some references add more rights to the right documentation, right reason, right response. Documentation matters because if something isn't recorded, it's as if it never happened from a legal standpoint. The NCLEX might ask you how you document a refused medication or a dose held due to low blood pressure. Clear, accurate documentation proves you're a safe and thorough nurse.